Waynad, in the northeastern corner of Kerala, is known for its breathtaking landscapes and rich biodiversity as part of the Nilgiri biosphere in the Western Ghats. It is also the land of Kerala Varma Padasi Raja, the valiant king of the Kottayam dynasty who led one of the strongest native resistances against British rule. Yet, behind this natural beauty lives a large tribal community, about 20% of the district's population. Waynad is home to 8 major tribal groups, including the Adiyan, Panyan, Mulluk Kurman, Kurichian, Ventaka Kurman, Wayanad Kadar, Kattu Unyakan, and Tachanada Muppan. Most of them earn their livelihood through cultivation as household helpers or daily wage labor. Even after more than 75 years of India's independence, these tribal communities continue to struggle with deep challenges: low literacy, limited healthcare, inadequate connectivity, language barriers, and widespread landlessness. Recognizing these gaps, the Government of India has marked Wayanad as Kerala's only aspirational district, highlighting the need for inclusive growth and development. To respond to these pressing challenges, the Swami Vivekananda medical mission took root in Wayanad in 1972, starting humbly on a single acre of land in Muttil. On Ganesh Chaturthi that year, a modest hospital with just 2 small buildings opened its doors, marking the beginning of a long and dedicated journey. In the early days, very few patients came forward. Limited awareness and poor transport kept people away. So, SVMM reversed the approach. If patients could not reach the hospital would reach them. The mission began training young people, especially women from tribal communities, as Swasthya Mitras. Carrying basic first aid and vital knowledge, they travel into the remotest villages, spreading awareness on hygiene, preventive care, and protection against contagious diseases.
In the tribal community, this sort of anemia was common, and actually we didn't know what is the cause for it. And during time, the medical officer then there, Dr. Sadhdev, who came from Nagpur, is very familiar with the disease, and he could recognize it is nothing but sickle cell anemia.
Sickle cell anemia, a serious genetic blood disorder, is widespread among the tribal communities and weaker sections of society. It lowers hemoglobin levels, leaving the body vulnerable to severe complications and, in some cases, even sudden death. Guided by Chief Medical Officer Dr. Dhananjay Sagdev, SVMM was the first to confirm the presence of sickle cell anemia among Wayanad's tribes.
Swami Vivekananda Medical Mission was the first to detect the sickle cell disease in Wayanad tribes, and with the help of All India Institute of Medical Sciences, Delhi, we conducted a research project for 4 years, and we screened nearly 1 lakh population and distributed the cards to the patients. And since then, we are continuing with the treatment of the patients. We are screening whole of the tribal population. There are 2 methods. One is the card method. We have got coded cards. Red card for sickle cell disease, blue card for carriers who are AS, and white card for who is normal, that is hemoglobin AA. We are distributing health education material also to all the population so that they understand what is sickle cell disease and how is prevented. Most important to prevent birth of new is the pre-marriage counseling, so that we can prevent the marriage of 2 carriers or 1 carrier and deceased patient. And if this is successful, we can prevent birth of new sickle cell disease patient in Wayanad in next generation. Next is, we have got this HPLC machine. This is the only one in Wayanad, that is high performance liquid chromatography. So we can give percentage of sickle cell disease, then thalassemia, hemoglobin F, A2, everything. So we are very fortunate that we are giving the best result.
Every year, the mission conducts over 500 diagnostic camps and tests more than 10,000 individuals. Through these sustained efforts, SVMM stands with India's national mission to eliminate sickle cell disease by 2047.
ये संकल्प है हर साल सिकल सेल एनीमिया की गिरफ्त में आने वाले 2.5 लाख बच्चे और उनके 2.5 लाख परिवार के जनों का जीवन बचाने का.
To meet the vast healthcare needs of Waynad's tribal communities, SVMM today runs a modern 36-bed hospital. Each year, more than 67,000 people receive free care here, including over 42,000 patients in the OPD alone.
I came into contact with Swami Vivekananda Medical Mission Hospital. I was really impressed by the comfort that the tribal community found in coming to the hospital, taking treatment there.
The hospital brings in visiting specialists in cardiology, urology, pediatrics, and eye care. Diagnostic facilities include X-ray, ultrasound, ECG, and endoscopy, with a CT scan and dialysis center soon to be added. It is also a designated TB treatment hub with services in physiotherapy, dentistry, pathology, and pharmacy, alongside outreach for oral cancer patients. Tele-epilepsy medical camps are conducted regularly in association with Amrita Institute of Medical Sciences, Kochi. In addition, eSmart Clinic is established for conducting lab tests which provide instant results. A quiet Dhanvantari temple within the campus offers comfort to patients and families. But SVMM's care does not stop at the hospital gates. Every single day, mobile medical units set out from Muttil, navigating muddy tracks and forest paths to reach the last mile. Carrying doctors, nurses, medicines and diagnostic tools, they have treated more than 9,000 patients in the recent past. For many families in remote villages, these vans are the only ray of hope. Specialized health camps and sickle cell testing are also taken directly to the villages. The mission's resilience and grassroots presence was proven during the COVID pandemic. It set up 27 panchayat-level COVID help desks, conducted RT-PCR testing, disinfected homes, and ran its Muttil hospital as a designated COVID center. Beyond healthcare, SVMM is engaged in education and empowerment. In 2002, it founded Sri Sankara Vidyaniketan at Cherukara, where children are nurtured in academics, Sanskrit, yoga, arts and values. Students receive free books, uniforms, meals and transport. Today, the school has 190 students and a new higher secondary campus is under construction.
Cherugara is a small village, and here most of the people are belong to below poverty line, but parents are eager to send their children to this school because we give that kind of value education here.
SVMM also runs 125 one-teacher schools across 21 panchayats along with special centers for school dropouts.
Every day, about 2 to 2.5 hours classes are conducted, having 2 teachers, and we hope to reduce the reduction by creating some sort of a good atmosphere in the center as well as giving them snacks in the afternoon. We hope by end of this year, we'll be able to show a substantial rate in school reduction.
Women's self-help groups, vocational training in nursing, lab technology, and handicrafts have empowered families socially and economically. In times of calamity, be it floods or the devastating landslide of 2024, SVMM has been at the forefront of relief. Its multifaceted work rests on the pillars of Swasthya, Shikshan, Samaj, Samskara, and Swavalamban. Partnerships with institutions such as Cochin Shipyard, SBI Sanjeevani, and Seva International have strengthened its reach and impact. At the heart of it all is Dr. Dhananjay Sagdev, who built this mission from scratch with dedication and trust. He worked in remote villages with minimal resources, built trust step by step, and grew a local team. His lifetime of service was recognized with the Padma Shri in 2021.
So in long run, with our all multi-purpose activities for our Masi brother and sister, and to help our Prime Minister to have a developed India, we see that with our all activities, our Vanvasi brothers, they come into the national mainstreams and become a good citizens and help in developing India.
From a humble 1-acre beginning to a presence across 150 villages, SVMM has brought health, education, and dignity to the tribal communities of Wayanad. But this journey is far from over. To continue reaching the unreached and to build a brighter future for every tribal family in Wayanad, we need your support. Your contribution can heal, educate, and empower lives of tribes in Wayanad. Join us in this noble endeavor. Sarve Santu Niramayaha.